Hello, I'm Dr. Gary Carver. I'm the Chief Medical Officer of the hospital, and I've been doing outpatient care and inpatient care since the 1980s here. And this has been my home for almost 40 years. I'd like to talk to you about some things that, nobody, it's pretty unanimous, almost no one wants to be admitted to the hospital. And there's things that we can do that can dramatically reduce your chances of not just being in the hospital, but requiring certain procedures, coronary stents, a lot of inpatient type work. Some things can't be prevented, but oftentimes with either outpatient preventive care, which I do in the clinic part-time, or getting to the emergency room sooner than later, it can make a big difference in outcomes. With a lot of situations, time isn't on your side. You get chest pain, you get dizzy, you get lightheaded, short of breath. Sometimes it can be real serious, and we all tend to be in denial that anything bad can happen to us, but a serious thing can come on anybody, and generally delays in care, if anything, may take longer to turn around. Thankfully, most of the time we can, I call it play catch-up football down in the emergency room and still save people that waited a long time to get in. It's every day, pretty much, when I work on the intensive care unit. But it's just not good to live that close to the edge any more than you have to. Things are under your control. When you feel terrible, it's best to get to ER, because it may not be serious, which is great. They run a bunch of tests and maybe able to send you home. But if you're in trouble, with your heart or your septic, common stuff. I mean, we see it multiple times a day right here in our emergency department. I mean, multiple serious problems that happen every day in this county in our ER. There's so many serious things we can handle right here in town. The bottom line message is regular outpatient care, and it doesn't have to be that complex. There's guidelines to follow based on your gender and age and family history of very simple things you can do as an outpatient to reduce your chances of premature death and hospitalizations. And then there are other times where things still happen. People get ill despite taking pretty good care of themselves, and they can happen pretty quickly. So when in doubt, have someone take you to the emergency room if you're feeling terrible, or call 911. Don't be embarrassed to come in and find out that this chest pain was a heartburn or something like that, because if it turns out to be something serious, the sooner you get care, the better.